Checking your blood pressure at home is one of the best ways to stay on top of your heart health, but only if you are doing it the right way. So here's how to help you to get the most accurate results. Before you take it, avoid caffeine, exercise, or smoking at least 30 minutes before. Empty your bladder because, believe it or not, a full bladder can raise your numbers. I want you to sit quietly in a chair for at least 5 minutes with your feet flat on the floor. And most important, use a reliable device with the correct cuff size. When you purchase one, take it to the doctor with you to make sure it's calibrated correctly and giving you accurate readings. The medical assistant can compare these numbers to their machine and make sure they're doing it properly, because a lot of times they want to take your blood pressure right when you walk into the exam room. Don't sit there and let them do it. I want you to politely speak up and ask them to wait a few minutes so your heart rate can come down. Now, let's talk about positioning. I want you to sit up with your back supported in a chair. I want feet flat on the floor and your legs uncrossed. Rest your arm comfortably on a flat surface at heart level if possible. Worst case scenario, just rest it gently at your side. I want you to wrap the cuff around your naked arm, no clothing, above the bend of your elbow. There sometimes is a little arrow on your cuff to show you where to line it up properly. Now, during your measurement, try to take it at the same time every day. I want you to stay relaxed. Don't talk. Tell your kids, your family members beforehand you're about to take it so you're not interrupted. Take at least 2 readings 1 minute apart. For heart failure patients, I personally recommend 3. If you are on blood pressure medicine, you are going to take 1 reading when you wake up, 1 right before you take your medication, and 1 reading exactly 1 hour after taking your blood pressure medicine. Now, I know this sounds like a lot, but this will provide your doctor with the accurate analysis on how well your medication is working. Record your results every day, share them with your doctor during your visit, or you can send it through my chart if you're comfortable that way. If you have a reading that's 180 over 120, you may be in a hypertensive emergency. The most important thing I want you to do is stay calm. Wait a minute or 2 and complete 2 additional readings. If it is still high and you have no symptoms, contact your doctor through an emergency line or a portal. If you're anything like me, your girl calling 911, but that's just me. Especially if you're having chest pain, dizziness, blurred vision, headaches, etc. At the end of the day, your numbers matter, and knowing how to measure them the right way gives you and your healthcare team the clearest picture of your heart health. I hope this information is helpful to somebody somewhere. I started this game as a fun way to educate patients and the community in a unique way that's not just reading a pamphlet. It's free to play, you're learning, and you have the possibility to earn some cash or a gift card while doing so. I am looking forward to growing with all of you, and remember, knowledge is the best medicine. See you next time.